Welcome to today's Explainer. Look, right now there is a highly complex, incredibly urgent medical situation unfolding out on the high seas. I mean, it literally reads like the plot of a Hollywood medical thriller, but guys, this is entirely real. Health authorities across the globe are currently locked in this high-stakes race against time. Their main objective? They need to frantically trace dozens of passengers who disembarked from a luxury cruise ship, the MV Hantavirus, just before a deadly outbreak of Hantavirus was detected on board. As we track this developing news story today, we're going to be looking closely at the data, the actual virology behind it, and of course, this completely unprecedented international response.
Okay, let's dive into this briefing docket. We've got the global tracing race, understanding the Andes strain, the timeline of the MV Hantavirus, the worldwide impact, and finally, the standoff in the Canaries.
Right, to truly wrap our heads around the sheer gravity and the scale of the situation, we actually have to start with this number 12. The World Health Organization is currently in direct contact with officials across at least 12 different countries. They are urgently, and I mean urgently, monitoring citizens who are either on this ship or who have recently returned home. We're talking about a massive international dragnet here, pulling in countries like Canada, Denmark, Germany, the Netherlands, New Zealand, Singapore, Sweden, Switzerland, Turkey, the UK, the US, and St. Kitts and Nevis.
Section 1. The Global Tracing Race, a Worldwide Scramble.
So this scramble is an unprecedented logistical challenge, right? And the stakes honestly couldn't be higher for global health agencies who are literally working around the clock. Here are the stark numbers we're dealing with right now. 5 cases have been confirmed, and tragically, that includes 3 deaths linked directly to the outbreak on this Dutch vessel. Now, while the WHO has been clear, this is not the start of a massive global pandemic like COVID-19, mainly because this specific virus needs close, intimate contact to spread. They have issued a very serious warning. The incubation period for this disease can be up to 6 weeks. Think about that. That means the window for new cases to emerge is wide open, which makes this race to trace exposed individuals absolutely critical.
Moving on to Section 2, Understanding the Andes Strain, Virology Context. To really grasp why international health organizations are responding with this level of urgency, we need to understand the basic science behind the headlines. So let's start with a baseline definition here. What exactly is a hantavirus? Well, typically, it's a virus that spreads from rodents to humans. People usually get infected by breathing in air that's been contaminated with virus particles, stuff originating from rodent urine, droppings, or saliva. So in normal circumstances, this is definitely not a virus you'd catch just by sitting next to someone on a bus, right? You catch it from environmental exposure to rodents.
And this brilliantly illustrates exactly why this specific outbreak is so incredibly alarming. While a typical hantavirus spreads strictly from rodents to humans and stays highly localized, the strain responsible for the MV Hantavirus outbreak is the Andes strain. And this specific variant allows for rare but very real human-to-human transmission through close contact. Furthermore, according to the WHO, this event marks the very first known documented transmission of this virus taking place on a boat. So we are looking at a truly unprecedented maritime health event here.
Section 3. Timeline of the MV Hantavirus. Tracking the journey.
So you're probably wondering, how did this rare virus make its way onto a luxury cruise ship in the first place? Let's reconstruct the timeline. The cruise, which is operated by Oceanwide Expeditions, kicked off on April 1st, departing from Ushuaia, Argentina. On April 13th, it made a stop at the super remote Atlantic island of Tristan da Cunha. Then, on April 24th, 32 guests disembarked at the island of St. Helena. But it wasn't until May 4th that the first confirmed case was actually reported. Now, as for where this all started, well, the WHO noted that a Dutch couple on board had taken a pre-cruise birdwatching trip through Argentina, Chile, and Uruguay. And they visited sites known to host the specific species of rat that carries the Andes strain. Now, while that source isn't officially confirmed just yet, the Argentine government is actively investigating this as the potential ground zero for the infection.
Section 4. A Worldwide Impact. Tracking the Global Spread.
Now, what's really interesting about this slide is seeing how that exact moment when those 32 guests disembarked at St. Helena on April 24th turned a localized shipboard problem into a scattered global exposure risk. Just look at the data. It reveals the terrifying geographic reach of this outbreak. Over in the Netherlands, we're seeing 2 deaths, tragically a husband and wife, along with several suspected cases being actively monitored. The UK has 2 confirmed cases, which includes a retired police officer who was evacuated to the Netherlands, plus 3 suspected cases, with other nationals voluntarily isolating. Germany has recorded 1 tragic death, with 6 of its citizens still stuck on board the ship. And in the United States, the CDC has triggered a Level 3 emergency response. They are monitoring citizens across 5 different states: Georgia, Texas, Arizona, Virginia, and California.
But guys, the tracing doesn't just stop at the seaports. International air travel severely compounded this whole risk. A Swiss national actually tested positive for the Andes strain after getting off the ship in St. Helena. And even more concerning, French and Spanish nationals were exposed on a commercial flight traveling from St. Helena down to Johannesburg. Tragically, a Dutch woman who was on that exact Johannesburg flight died in South Africa. Because of that, the French Ministry of Health alone had to frantically identify and isolate 8 of its nationals who had contact with her on that plane. It just spread like wildfire through the transit hubs.
Now, as you can probably imagine, trying to manage a medical crisis across multiple continents, cruise lines, and commercial airlines is just monumentally difficult. One expert speaking to the BBC actually characterized the international outbreak response so far as, quote, highly chaotic and uncoordinated. It's a pretty sharp critique of our global health infrastructure. But it is absolutely vital to remember here, and I want to stress this. Despite this logistical chaos, experts emphasize that the overall risk to the general public remains extremely low because of the specific close contact way the Andes strain actually transmits.
All right, Section 5. Standoff in the Canaries, the current situation. While health agencies are busy tracing everyone who left the ship, we really have to turn our attention to the ongoing, incredibly tense situation for those who are still aboard the MV Hantavirus. 146. That is the number of people, guests and crew members from 23 different countries who remain essentially trapped on this vessel. They're just waiting, hoping to stay healthy, as the ship slowly approaches Tenerife in the Canary Islands. And it has been a really desperate journey for these remaining passengers. Before they even set a course for Spain, the MV Hantavirus attempted to dock in the West African archipelago of Cape Verde, and they were outright denied, just turned away. So the ship sat anchored off the coast for several days in this agonizing state of limbo before finally rerouting towards the Canary Islands.
But even their arrival in Spain is completely mired in this huge political and medical gridlock. See, mainland Spanish authorities agreed to accept the ship, to medically assess the passengers, and even quarantine Spanish nationals in a military hospital in Madrid. But the local leadership? They vehemently disagree. The Canary Islands president, Fernando Clavijo, stated plainly, "I cannot allow the boat to enter the Canaries." He's arguing that the decision lacked technical criteria and that they simply haven't been given enough information, setting the stage for a dramatic jurisdictional clash.
So, the crucial point here is this incredibly difficult friction between providing humanitarian aid and local self-preservation. Residents in Tenerife have been expressing deep anxiety to reporters. They're worried that by opening their ports, they might inadvertently introduce a deadly pathogen straight into their island community. As one local resident put it, people do need help, but they fear they could end up with a problem on the island. It is literally a modern-day quarantine dilemma playing out in real time.
Which brings us to the ultimate question we're left with as this entire crisis continues to unfold. How should global health protocols adapt to cruise ship outbreaks in a post-pandemic world? The MV Hantavirus has really shown us that even a rare virus requiring intimate contact can spark a massive, multinational scramble when you place it in the highly mobile context of international tourism. It absolutely forces us to ask if our global tracing networks and port authorities are truly prepared for the next maritime medical emergency. Thanks for joining me for this explainer today. Keep this question in mind as you follow the news, and as always, keep exploring.